us, Speaker Pro Tem Jason White in the house. Good morning, sir. How are you? It's good to have you.
I'm good, Paul. How are you doing? Good to be with you.
Did you see some of that wet stuff outside?
Well, I just a little bit, enough for me to test my wipers. It's been so long since I've had them on. They did come on, and they did work. But
do be careful, because we've got a lot of days out there of stuff piling up on the roads, and when it rains for the first time, it's a little slick.
It is slick.
If nothing else, maybe it'll at least cut some of the pollen out of the air and help that out a little bit. But it's not much of a rain, but at least it's a little bit of moisture, so we'll take anything we can get.
Look, Paul, all my hunting buddies, we're all wanting rain for food plots and for hunting season coming, and our farmers are like, all our farm friends are like, look, it's better now for no rain. We need to get our crop in. The time for rain has passed, and we're dealing with it. And
I do believe that they're not going to have a problem with that one. It doesn't look like it for the next couple of weeks, but we'll see what happens.
They're not, for sure.
Man, a lot of things going on. I know you're following all of this, and story number one is the hospital board deciding to axe Tim more. And your thoughts on that?
Well, I don't know that I have many thoughts on it. Certainly, I was not involved in any of their decisions throughout the year, the campaign season, and their strategies, and then ultimately, I guess, even with them letting Tim go. I think certainly there's no, just from the outside looking in, you and I both could probably come to the same summation that it had something to do with the fact that they chose to support Brandon Presley.
Well, I mean, it was not only that. Of course, when we had Tim on, and I know I got some pushback on being vocal about this, but it was not only it was not so much that let me see how I can put this. It was not so much that the association decided to put $250,000 behind Brandon Presley, but it was at a time when the legislature, you guys in the House and the Senate, and signed by the governor, was quite nice to the hospitals in the state by providing that package. And apparently it didn't matter. And then right after that, all of a sudden, $250,000 comes up to Brandon Presley. And it was just bad timing.
Maybe it was bad timing. I don't know. I've never understood how that board and the hospital association in and of itself, I've never understood fully how it works. I've thought, on several occasions over the last several years that they made steps that I wouldn't have made if I'd have been calling the shot. But again, I don't know the ins and outs of that board. I do know this: he answers to a board, and so while he took the fall for it, a guy working for a board can only do what his board members are voting and telling him to do. So, but again, I don't know any of the inner workings of that. Obviously,
I understand.
Lots of folks pulled out of that and went a different route, or at least are not a part of the hospital association anymore. And so I think the next shoe is to drop on where they all settle, because certainly lots of hospitals are still left in the hospital association, but this core group.
They lost some of the big guys.
Part of last week's announcement.
I'm not sure if that's going to be back together again with a new leader or what. We'll see what happens with that. Since I understand was not a part of that one, but were you a part of any of the governor's decisions as far as House and people in the Senate, or maybe even the remaining speaker for a while longer, Philip Gunn, on putting this package together?
Not to my knowledge, Paul. Nobody on the House side that I'm aware of was involved in any.
Have you read through some
meetings.
Of this at all?
We have a little bit. I mean, what's available. I have not looked at what Drew submitted to CMS. So I mean, we're just seeing either what you report or what they release in their press conferences.
Does any of this have to go through the legislative process?
I would think probably some of it does, just based on some comments they made. I mean, certainly. You may or may not be aware, but the Medicaid tech bill is up this coming session.
Yes.
In other words, the whole thing repeals June the 30th if we don't reauthorize and do something with all the technical amendments that have been made to Medicaid over the year. So certainly it'll be up for discussion. I mean, there were some interesting things specifically as it related to their plan for the hospitals, and don't misunderstand, I'm all for an increased reimbursement for the hospitals. If there's a way to do that, I'm glad. Now, you heard some grumblings last week because some folks said this was brought up this time last year, and as well as early in the 23 legislative session back in the spring, early in January, February. And I think Drew acknowledged as much when he got the question of, hadn't y'all already looked at this? Why didn't y'all do this sooner? And I think his comment was, well, we didn't have the right people in the room, or we got the right people in the room. I don't know if that was a shot at, now that Tim Moore's not in the room, we're able to do something. I don't know, because that was well before the $250,000 donation. So I don't know the inner workings of that. I do know this issue of an increased reimbursement and changing the way we do that had been brought up previously, and it had been dismissed as it was insignificant. The amounts that you might gain would be insignificant. So I am glad that they went back and looked at it again after they had ruled it out. I'm glad they went back and looked again and were able to find a way to do it. But, regardless, they're talking about an increase of $680 to $700 million to our hospitals, which I would tell you is a good thing. I'm certain the hospitals would tell you that as well.
And that money's coming where? How's it coming to?
Well, I mean, that is the tricky part. I mean, it's coming from the same place. It's coming from the feds. It's mine and your tax dollars that go to Washington, and it's coming back. So it's not like it's falling out of the sky somewhere. It's federal money, that stuff that we preach for and against, depending on the day and the time and the place and who you are.
You could be and you're the likely heir to the throne there, so to speak, as far as Speaker of the House. You don't have your crown on yet, but I'm a little confused at the money that $250,000 million, or how much money was given to the hospitals. It wasn't that much. How much was it?
You talking about this past session?
Yeah, that past session. What was the figure?
That was $100 million.
It was $100
maybe
million.
103. It was right at
one point we said $81 million, but it was 100.
That's right.
We had somebody on not too long ago that says the money still hasn't been given to the hospitals. They still don't have it. Or, if so, most of it still hasn't been divvied out. Do you know what the status of that is?
Yes, they're working on it. It's part of it was not the amount or the parachute that they wanted, and so there was lots of disgruntledness over it being only $100 million, and it did come with some parameters and ways for you to access the money, and there were some restrictions. So all hospitals had to work through that. They are finally working through that, and folks will eventually be getting their money. I did hear some early on saying, "Oh, we're not going to qualify. We're not going to qualify certain ones," but now it looks like they all are for their proportionate share.
These were the regulations written into the bill by the state legislature, right?
That's correct. That's correct. And understand, hospitals get lots of other money from lots of other places, and this money affects other money, so they have to be sure that they're in compliance all the way around.
Jason White is my guest this morning. I think we heard at one point that some of this, and I think this was from the Louisville director of the hospital there, who basically said they found out that this was COVID funds that for your expenditures on COVID. But if you'd already gotten some reimbursements from that, then you could not qualify for this. Was that part of the problem? SNAP?
That was part of it, yes, because this money. Yes, I'll just say it that way. I think they have found a workaround for all of that.
You know what percentage of that money is already?
Of course, it also showed how much money hospitals had been getting, Paul, which was lots of money. Well,
here's the other part of that, because we heard that many of them were going to close their doors if they didn't get this, and if they haven't gotten it, they still haven't closed their doors. And the other part of this, and I think everybody wants to make sure, and they need that hospital there, certainly in the rural areas. But they have to retool these things. What I think people are worried about is if you – we'll talk more about it on there. What is the marketplace you have to listen to the marketplace. What is the marketplace telling these hospitals at this time? One way or the other. May not be what they want to hear, but what is the marketplace telling? There was an entrepreneur who once said that if you want to be successful in any business, listen to the marketplace. Let it talk to you. And I'm wondering if we're doing that in some of these small towns. Well, are we listening to the politicians?
And the trick for us as politicians is while the marketplace is reacting over here, what are taxpayers willing to pay, or what are they not willing to pay for when it comes to their hospitals? Right. And so that's the tricky part.
Hit wonders. I often wonder if anybody actually had that number, Lance, and if they did, did they check it out first of all? Well, different area codes.
Yeah, I tried every area code in the country, and it didn't go to anybody. So
there you go. Maybe they checked with the phone company before they did that. So. That was number 10 on the one-hit wonders, and I think we got a couple more coming up a little bit later. In the house, it is Pro Tem Jason White. So one of the things on the Presley ads, I'm not sure if they're his or the PAC out of north of the Mason-Dixon line who's done this, but it basically says, as soon as I am elected governor and sworn in, I will expand Medicaid. Now, I have heard from several people that this is not a possibility unless the federal government decides they want to give it to him without any state involvement at all. So do you know any of the ins and outs of this?
Well, I don't know. Certainly, I don't know any of his planning or the ins and outs of
no, I'm just saying, is it possible that a governor can go on and say, we're going to insure another 200,000 people without any legislative approval?
Short answer is no, Paul. Certainly, Medicaid in Mississippi is an executive agency. The governor appoints the director, and he's over there and runs it. And that's how, in its very beginning, that's how it was in Mississippi. It was an executive agency that was run by the governor's office. And the legislature, as it often does, started meddling in it and started making amendments. In other words, that's where we derive this big monster that we call the Medicaid tech bill. In other words, Medicaid is the governor's executive agency to run, except for these things that the legislature started saying, okay, you run it, but you have to do this, you have to do this, you have to do this. And over the years, that turned into this massive piece of legislation that's affectionately known as the Medicaid tech bill. So having said that, and then also, the legislature appropriates all monies that we spend as a state. And so you just couldn't run you couldn't make those types of decisions and do it. Now, certainly, you could apply for some sort of waiver and start running a program maybe, and if it doesn't require any state dollars, I don't know how far you could get with that. But I think but
it does. You have over $1 billion coming out of the.
I understand, but you ask about a new segment. I just don't know any way that could be done without legislative action. To answer your question, no, I don't.
If you put another 200,000 people on it, it's probably going to wind up to be 300,000 when it's all said and done. So you're going to have a majority of the people in Mississippi getting free insurance. Now, my question is, and I think this is a valid question that a lot of people are asking, because, number one, what will happen to businesses across the state who have employees within that pay range? Will they say, look, 60% of the entire employment here at this factory, whatever, will no longer cover you on Blue Cross Blue Shield simply because you're going to be covered by the state? So what happens if that domino falls across the entire state? You're talking about literally tens of thousands of people.
That's how you get to the number you're talking about of 300,000 people. I don't know. Are you advocating for expansion?
I'm just saying. I think the consequences of this are going to be to the point where what happens to the people who are still paying Blue Cross Blue Shield? We've heard that the people who are footing the bill it's going to cost you a lot more.
Maybe it will, maybe it won't. I don't know. We have expanded Medicaid in Mississippi.
Aren't those the things that we need to find out before we make a decision?
Yes. But my comments a couple of weeks ago were simply, we don't know because we hadn't looked into any of it. It was simply that. Now, to your point, what other states found when they did expand Medicaid, more folks did apply for that new segment of the population than what they had expected for whatever reasons. One of which was one of the things you just mentioned. folks figured out that was a better deal than what they were getting maybe where they worked. Now, again, the jury's out on all of that. The issue is this. You asked the question, could a governor expand Medicaid without legislative action in Mississippi? My answer to you is no. I don't think they could. They could try. They could apply for some sort of waiver, just like our Medicaid director has done in this instance with this additional and different, reimbursement for our hospitals, which, again, I'm very much in favor of. I just don't think it would work because of the appropriation and the technical amendments bill that we have in Mississippi. I don't think there's a way to get to a Medicaid expansion without legislative action. I don't think that could be done purely from an executive standpoint.
What do you think the legislature should do when it convenes in January on this subject, though? Because another one of the ads basically says, is from Brandon Presley, is saying that experts have said that expanding Medicaid will save the hospitals. And
I think we all agree that is not the case.
No, it's not the case. We've had other experts who said it won't make any difference at all. It's not going to be. It's not the problem that's going to save them.
Well, let's make no mistake. Now, all hospitals are still very much advocating for Medicaid expansion, even though they say it won't. It won't save them, but certainly they want that money and they like it. I think the uncompensated care figures peg somewhere around $500 to $600 million in our state that hospitals provide, and so. They're looking for anywhere to have to make that up. It'd be the same as if you had to take a certain segment of advertisers, on your radio station here, and they just didn't have to pay, but you had to let them advertise if they showed up at the door, at least to some extent. And so, hospitals are faced with that. They have to treat those patients, and so they're looking for anything, anywhere. But back to a point you made earlier, we've got to decide as a state and as communities what we're going to demand or expect in the provider realm of hospitals in our communities, especially our rural communities. And as my colleagues, especially my Republican colleagues in the House, have campaigned around the state this year running for re-election, voters are asking the question, what are y'all going to do about my hospital? Now, they're not necessarily demanding Medicaid expansion, but they're saying, what are you going to do about our hospital? We don't want to lose our hospital, because they've heard this with this governor's race going on. They've heard all that talk. But I come back to the point you just made earlier. When you get the hospital CEOs and execs in a room and shut the door, they will all, and some will say publicly, it will not save a bunch of these hospitals that are on the brink of closure. Just because, number one, Medicaid is not some Cadillac insurance plan that pays a lot of money for beneficiaries. So it's they would almost tell you they're not even at break even when they do serve a Medicaid patient that has Medicaid. So
that's the thing that one of the figures that was hard for us to assimilate, just rank and file out there. Because you had some of the hospitals saying we're going broke because of Medicaid patients and not getting the reimbursement. So what we want to do is get more of these. In the figures, it was almost like in this particular case, 2 + 2 is 5. It just doesn't add up over the period of time. So it's a little bit like Amtrak and the post office. When you start looking at losing money like this, and it's a government program, then you say, are you taking care of the problems of the post office, and are you taking care of problems on Amtrak? Are you in areas where you don't have enough passengers? You're running a train with 5 people on the car, and you just don't want to cut back because it doesn't look politically good for you. Same thing on the post office. Are you handling a lot of junk mail and losing mail, and you don't want to cut back? And are we addressing the real problems? And some of those are indigenous to each individual hospital in their community. Does that make sense?
It does make sense. I mean, that is the debate that is going on now. Not only in legislative circles, but in provider circles, as folks look at. I don't blame these hospital CEOs. They've got a job to do, just like you've got one, and Lance does, and I do. The problem is they don't have to balance that state budget, and they don't have to look at all the other things that we fund and do. They're purely worried about their hospital, and I get it. That's why they've been advocates for Medicaid expansion, because they don't, in their mind, they don't care where the money comes from. Now, there is the issue of the unhealthiness of our state, and the health outcomes of our people are terrible. They're bad. The poverty is real. Now, that doesn't enter into this discussion about hospitals and how they're going to make it or not make it. But it is a talking point, and it is worth noting that, as we look, there is this segment of our population that I would remind you is working. That's why they don't qualify for Medicaid, because they have a job, but yet they have no insurance. And people are starting to look at that and say, okay, are they just... We've been asked to live in this Affordable Care Act world that our congressional leaders passed. We've been asked to live in that world. 40 states have gone that route.
I'll give you the final say coming up in a moment or two. We'll get a quick break back. Final thoughts from the speaker of the pro tem speaker of what you think the legislature is going to look like, and what do you think the top three things are going to be as far as 2024 session, which is going to be 4 long months, by the way.
It is 4 months, Paul.
Yeah.
Look, top three things. The one we've just been talking about here, and that is what I'm going to call, health care, hospitals, provider issues, Medicaid tech bill. We hadn't mentioned CON, and we don't have time to get into that today, but that's another area where we're going to really drill down in that area. We may start in rural areas first and take the cuffs off there. I mean, I don't know exactly what it looks like, but folks are demanding something in that space. And I think it does make sense. And so we're going to have a real look at that as well. But here's another thing we hadn't talked about. PERS. That issue is looming for our people. And again, what are taxpayers willing or not willing to pay for on an issue, and this one being a public employees retirement system. And so as you ask for a 10% increase in the employer contribution, well, that employer are different state agencies and counties and cities, and folks have finally said, look, we can't stand a 10% increase. And so that has driven folks back to the table to sit down and try to figure out a way forward as we look at a $19 billion hole. It's a real issue, and I think we're going to have to finally deal with it one way or another. We've kicked the can for a long time, even before I was in the legislature, but it's come home to roost now.
Is it sustainable if you continue with the 13th check?
It's not sustainable in its current form. I mean, when you look at the program as a whole. Now, there are ways you could do some cash infusion. You could, phase some of this stuff in. You could change for new hires. There are lots of things you can do to get it closer to something that's manageable. But in its current form, no matter what anybody tells you, it is not sustainable long term. And that is my concern. Yeah. We have some duty as legislators to be adults and sit down and have a tough, real conversation. If this was happening with the SuperTalk retirement plan, this place would be on fire. Something would be going on. Something would happen.
Is some of the problem is going to be the stock market itself, of course, in a downturn, right?
Yes. And Paul, you asked for top three. We talked about healthcare. We talked about PERS. The other one is as I keep talking about election year, but as folks have been knocking on doors and candidate forums and seeing their voters and folks, the other thing that has really finally come to the forefront is a real, y'all like to call it school choice. I call it parent choice. We're fixing to have a real debate, discussion, and legislation that gives parents in Mississippi, and we may have to start in failing school districts and DNF districts, but they're fixing to have a real choice to have some sort of ESA, an education savings account, to take that money, the state share of the cost per student, take that money and
I think
go
that's
somewhere
number
else.
one. I'd put that at number one. I really would.
It is its time has finally come, and look, I almost wish we were going into session, next week in October, because it is fresh on my colleagues' minds as they've campaigned around the state. Did you,
more and more people want this, because we have to get over the notion that it's going to be counterproductive to racism or something like that. Because the people who are going to be able to partake in this are going to be in the areas of the state that are the most downtrodden.
Absolutely, they are.
And then we have people on the air who say things like, well, it wouldn't work in my county. Well, big deal. That doesn't mean it should not be tried somewhere, somehow.
That's exactly right. Well, look, here's what whether anybody wants to admit it or not, we have to realize that in certain school districts in certain parts of our state, they're chronically failing schools. And so you can't tell me what we're doing is working. Now, the argument of lack of funding. That's all we need is more money. I think we've put our money where our mouth is on that topic, and we have funded schools. Now, you can go back 20 years and say, oh, yeah, but you hadn't for this long period of time. Well, we are now, and we're ready to look at other alternatives. And parents, frankly, are demanding it.
I had a story last week. It was another state. I forgot what it was. I tweeted it out. Another state has just done that, and I forget which one it was.
Well,
do you know?
Arkansas is the big one. We spent some time last week with one of their state senators who really was the driving force behind that bill. You should have her on this program one day. She is, boy, to hear her story and the way that they got that bill through Arkansas legislatures is
I know
pretty interesting.
Governor Sanders, Huckabee Sanders, is all in for it. But there was another state that just okayed that. And I forgot what it was. But this happened just a couple of weeks ago.
There are lots of them. And it's happening around us, and it's time for us.
I agree with you 100%. If you are going to break the stranglehold of poverty in this state, I think that's one of the best ways to do it. It's just a better education, period, and school choice. Because there are a lot of parents out there who are demanding it now more than ever before. Jason, thank you, man. Appreciate it very much, and thanks for coming in.
Appreciate it. Enjoyed it.
You got it. Jason White, the Speaker Pro Tem.